We have a jam-packed agenda today, but this is the time that I get to take my little 10 minutes to talk to you about some things that I think you need to be aware of, some things that are important, and then we'll move on to the rest of our really exciting program. What I want to tell you is something that's really kind of serious, and it's serious in an important way. We've accomplished a lot in the last few years. We're really in a position now where we're at the table in so many different ways, not just one way, but a lot of different ways. For example, I want to give you a few examples of those. One of them, let's talk about public relations. And I mentioned this a little bit in our town hall meeting yesterday, and thanks for those of you who attended the meeting, but we're being asked to quote on a lot of things. Sometimes we're asked to quote on things where it's not really our issue. And why are we asked to quote? Because of our credibility. Just because of who we are, we're asked to quote on things because they know that we'll give an honest opinion about whatever that issue is. In fact, as I said yesterday, we've been quoted over 700 times since this time last year in various weeklies, in major news outlets, and on television. And we're working on different types of PR projects. One of the neat ones that we worked on this past year, it was a special that CBS did on wellness and prevention and obesity and those types of things. And we're going to run just a really short clip to show you what that was. I don't know how many of you saw it.
The costs of health care due to related illnesses from poor diet and lack of exercise are growing faster than you can say supersize. In 1987, cost for physical inactivity was estimated at $25 billion per year. Today, it's at $93 billion a year.
Obese people pay 36% more for their inpatient and outpatient care, and a staggering 77% more for their prescription drugs. When they do go into the hospital, they stay in 45% longer than the average person does.
There's no such thing as health care, it's more like sick care, and all of the hospitals have turned into big emergency rooms.
So is this health crisis just an American issue? And how healthy are we compared to the rest of the world? We'll find out.
It was a half-an-hour show, and it was a good show. We worked with Bryant Gumbel, and it was kind of interesting, and we hadn't done something kind of, really like that before. It was kind of a longer piece, although, of course, you only get the small clips. But so we've had, in our PR efforts, we are definitely at the table, and we're being called by a lot of major outlets. And, of course, I know that you all know that we've had the very good fortune to be closely consulting both the White House and various federal agencies on a number of different regulatory matters. The people call us, though, I want to make sure you understand this, because of you. They know that you all have your fingers on the pulse of America. And they're elected and they want to know what America thinks about these issues. And that's why they call and ask us to be involved. One of the things that I want to tell you about, one meeting that was it was one of the neatest things I've ever done. We go to the White House all the time. We get called, we're there for meetings all the time. But some meetings, are more special than others. And one particular meeting that I was invited to a couple months ago was actually in the Roosevelt Room in the West Wing of the White House. And that's just right, it's very close to where the Oval Office is. There were about a dozen other people that were in the room, and everyone had been invited to this particular meeting because of their role in working on getting people enrolled in the new Medicare programs. Now, I want to emphasize, this was a really small and exclusive meeting. I was the only person there from the insurance industry. And the meeting was with President Bush himself, and he thanked me for everything you all have done for getting people enrolled in Medicare Part D and Medicare Advantage. I don't know if you're aware of this, but more than half of you have enrolled at least one person in Medicare Part D, and some of you have enrolled many, many people. In fact, the majority of people that are enrolled in Medicare Part D have been enrolled by agents. And so you have played an extremely important role in making this a success, and I was very proud when we were pointed out to be a part of that success that day. I want to show you this picture. This is a picture of the meeting. And I don't know if you can see that, the little head at the table with a hand like this. That's me. And I just got this picture in the mail Saturday, and my husband kindly scanned it and sent it over here so we could show it to you. So I just wanted to let you see that. So, I mean, we definitely are at the table with the administration, and not just political appointees, by the way, career employees as well that are going to be there with any change of administration. I mean, we were literally at the table that way, but we're definitely at the table, as we are on a lot of different issues. And I want you to let you know that, again, we're there because of you and because of the difference that you are making in people's lives relative to helping them obtain health care. And one other thing I want to point out to you is Congress. We're at the table there too. You know, they call on us for our expertise all the time. And I wanted to show you just one example. We work real closely with both the House and the Senate. Recently, we wrote a letter to Senator Enzi. We were concerned about a bill that was put forth by Senator Durbin, and we were outlining all the various reasons why we were concerned with that particular bill. And we didn't know that he would do anything with the letter that we wrote, but he sure did, and I'll show you what that was.
Lastly, I'd like to have a letter from the National Association of Health Underwriters be a part of the record. I'd ask unanimous consent.
Without objection.
And again, it's a much more extensive letter, and I hope people will take the time to read the record, but from the National Association of Health Underwriters, and these are the experts on health insurance. They look at this stuff all the time. It says that 2510 creates the worst kind of unlevel playing field. The cost of coverage would be predictably high, an increased number of people being priced out of coverage, and the bottom line, more rather than fewer people would be uninsured. National Association Health Underwriters.
So I just wanted to show you that we are working for you. And, but what I wanted to tell you is that, you know, we've grown up. And there's an important part of this message that, you know, we're not a small organization anymore. We've gotten much more influential. We've grown up, and growing up is a good thing, but it has strings attached to it like anything else. You know, when you grow up, people listen to you, and that's important. But let me stress that they listen to you. And that means you have to be very, very careful what you say. You have to assume that anything you say or write is going to be produced either in a good way or not a good way. And we have to be careful what we say, and we're doing that, and I know that you're doing that as well. But we're going to be working a lot and continuing further on our PR efforts to make sure that we say the right thing. You know, being at the table like we are means that you'll be listened to, but that you also have to listen. It means that you don't take anything for granted. It means to use your influence to enhance your position as much as you can. And it means that we have to work really hard in a lot of different ways. So we have this opportunity to be heard, and we need to make sure that we're heard in the right way. So we need to work hard to grow our membership so that our voice is even louder, because now's the time people are listening. And all the things that we do, we need to make sure we contribute to HUPAC so that we can get the right people elected to office. All the things we do are going to make a big difference for people, not just our livelihoods, but all the people you serve all across America. What you do is so important. You know, I have to tell you, and I hope that you believe me, I am so proud to be your leader. I am so proud to lead this organization. I am so lucky. I'm proud that when we have speakers like Mary Matlin and James Carville that we had on Sunday, before they walked out, I said, "You're going to love our audience." And they did. They did. They loved you. You were responsive. And I'm always feel so good about being able to tell people that. I'm proud that you're willing to get involved with your time and your money to make sure that people continue to have choices in financing their health care. And I know that we're going to have challenges over the years, but together that we'll be able to face them and work through them and do the right thing. And I am looking forward to working with all of you for a very long time. So thank you.